Most people know that glaucoma has something to do with eye pressure, but did you know that pressure is only part of the story? Glaucoma can happen for several reasons, and they all have one thing in common: damage to the optic nerve. Let's break down what really causes glaucoma and how it can affect your vision. I'm Dr. Constance Okeke, your host. Glaucoma is caused by damage to the optic nerve, the cable that connects your eye to your brain. The optic nerve carries visual information from the eye to the brain, and when it becomes damaged, vision loss can occur. Once that vision is lost from glaucoma, it usually cannot be restored. The most common risk factor for optic nerve damage is high eye pressure, also called intraocular pressure or IOP. Inside the eye, there is a clear fluid called aqueous humor. This fluid is constantly being made and constantly draining out of the eye. In a healthy eye, there is a balance between how much fluid is produced and how much fluid drains out. The fluid drains through the eye's natural drainage system, including an area called the drainage angle and a filter-like structure called the trabecular meshwork. When the drainage system does not work well or becomes blocked, damaged, or less efficient, fluid can build up. As fluid builds up, the pressure inside the eye can rise. Over time, that pressure can injure the optic nerve. But here's something important. Not everyone with glaucoma has high eye pressure. Some people develop glaucoma even when the pressure looks normal. This is often called normal tension glaucoma. In these cases, the optic nerve may be more fragile or more vulnerable to damage. Poor blood flow to the optic nerve may also play a role, meaning the nerve may not be getting the support it needs, even if the eye pressure is not very high. There are also secondary causes of glaucoma. This means glaucoma can develop because of another problem in or around the eye. Examples include eye trauma, severe inflammation, previous eye surgery, or long-term steroid use. These conditions can affect the drainage system and cause the pressure to rise. Age is another important factor. As we get older, the optic nerve may become more susceptible to injury and glaucoma becomes more common. So when we talk about what causes glaucoma, it is not just one thing. It can involve eye pressure, the drainage system, the health of the optic nerve, blood flow, age, and other eye conditions. Here's the bottom line. Glaucoma is caused by damage to the optic nerve. High eye pressure is the most common risk factor, but it is not the only one. That is why regular eye exams and glaucoma screenings are so important, even if your vision seems fine and even if you have never been told your eye pressure is high. Early detection gives your doctor the best chance to protect your optic nerve before serious vision loss occurs. So what happens if your doctor tells you that you're a glaucoma suspect? Does that mean you have glaucoma or just that you're at risk? In our next video in the Glaucoma Patient Journey video series, we'll break down exactly what that term means and why follow-up is so important.